Quitting medicine, a career I never really wanted to pursue in the first place, was the single hardest choice of my life. Shouldn't it have been easy if I never really wanted to be a doctor? Doing the right thing is never easy because excuses get in the way. And excuses are fear. And that fear, the big fear, the fear of leaving medicine and actually becoming who I was, used to wake me up in the middle of the night, drenched in sweat. Besides a shower, what I really needed was to see how somebody else had navigated their way out of medicine and into another career. And that's what I'm offering today. A playbook for how I overcame the excuses, the existential fears, and finally quit medicine and got where I am today, doing something I love, writing and owning a furniture refinishing business. Okay, let's overcome the top 5 excuses, starting in descending order. Excuse number 5. If I quit, I'll waste my doctoral education and training. There's a fair chance in my life, across my life, I will never know a single thing as well as I know psychiatry or medicine. And you know what? I'll admit it. Knowing things feels really good. Our ND or DO was earned in blood, sweat, and years. How can we just give up those initials now? And more importantly, how can we give up all that expertise? Being called by my first name again has not ruined my life. In fact, it's had no bearing on my life, positive or negative. When somebody calls me Dr. Fightmaster now, it makes me laugh. And I'm like, oh yeah, I'm a doctor. It's kind of like finding a $5 bill in your pocket, like a pleasant surprise. So, will you be flushing a decade, 15, 20 years worth of expertise down the toilet if you quit? I say that's up to you. I can't afford to see it that way. For one, I use my medical training, I use my psychiatric training every day. I'm a better writer because of it. I'm a better communicator with my furniture refinishing clients because of it. And maybe becoming a doctor was the only way for me to find out I didn't need to be a doctor. That's been a valuable, instructive understanding of a cul-de-sac. And it got me here, knowing who I am, knowing what I want to do, and knowing a lot more about what I care about in life. Excuse number 4, if I quit, I won't be helping people anymore. Yes, being a doctor is often a noble endeavor. Yes, being a doctor is often selfless, but let's not get it twisted. Healing happens in many forms and in many different uniforms. Medicine is not the only way to provide value to humanity. Example, if I'd have stayed in psychiatry, seeing 14 to 18 patients a day for years, I would have helped thousands of patients. Also, that would have made me incredibly depressed, and I would have ended up needing to see a psychiatrist, get prescribed an SSRI, and become a patient myself. That would not have been noble. That was not selfless. That would be called codependency. To stay in medicine was to be depressed, but I was helping people. To leave was to be happy and not depressed. And in clinic, every single day, wasn't that what I was trying to get my patients to do? Become themselves and be happy? Yes. If we're in the right job, doing the right thing at the right time, we will help people. Good things will happen. And we ourselves will be healthy. And whole, healthy people always find a way to help other people. Whether it's by making their chairs look better, or being a good therapist. Excuse number 3, if I quit, I won't be able to pay back my loans. This really boiled down to one simple question. Would I rather be happy living in debt, some rather significant 6-figure debt, or would I rather hate my life and pay off my loans? I don't really think that's a choice. So I took the first choice. My view of the situation was that if I was capable of becoming a doctor and a board certified psychiatrist, while never really wanting to be a doctor in the first place, then I was capable of figuring out how to pay back $200,000 worth of loans while not being a doctor. If I was who I am, I was gonna find a way to pay back those loans. Now, have I paid back those loans? No, I have not. It's been 3 years. I'm still working on it. But I'll tell you what, I'm in a much better place. Am I debt free? No, I'm not. Full disclosure on that. But I'm chipping away. And if I continue doing things that I love every day, will that result in me paying off my loans one day? You're damn right it will. Because if that's not true, I don't know what will be true in this world. And in the meantime, I'll be making payments by refinishing chairs and dining room tables that sit right behind me. One table and chair at a time. Excuse number 2. This excuse was almost number 1. If I quit, I'll disappoint my family and possibly get disowned. I've covered this subject a lot by now. Even did a video where I lay out exactly how to tell your parents you don't want to go to medical school or you don't want to be a doctor anymore. This excuse is big, primal, Oedipal. I am an American. I am almost entirely Western oriented in the way that I grew up seeing the world, which means that I have a slant toward individualism, which is to say that typically in my value system internally, I care a lot about independence and autonomy more than I do community and family. That doesn't mean I don't care about community and family. I care about that massively. I just am of the belief that if you are not who you are and there's not some form of individuation first, then who you are with your community and family suffers severely, and so do those relationships. But even me, an American, has struggled massively with not wanting to disappoint my family if I quit medicine. You're a good doctor. Your patients really appreciate you. You do a good job by basically every measure. I would expect your parents probably brag about you at every chance they can, and most of their friends know that you're a doctor or a medical student or a resident physician. But let's say for this example, you don't want to be a doctor. Doesn't that corrode the merit of all the other accolades? Can't you see how easy it is to lose yourself in the long term when you're in an environment where you yourself can't take pride for your accomplishments because you yourself don't want to do it? These are rhetorical questions, but you get the point. Family is a really noble excuse to continue doing things you know are unhealthy for you. And after all, there are worse things in life, worse professions to hold in life than being a doctor. Like being a lawyer. Just kidding. But eventually, one day, if you keep doing things only to keep your family happy, you might wake up, look at yourself in the mirror, and not be able to recognize yourself anymore. Excuse number 1, if I quit, I will actually have to go figure out who I am. In 2015, toward the end of my first year of medical school, 10 years ago, for those keeping score at home, I was studying at a Whole Foods on the patio. It was a glorious spring evening. I was trying, with some success, to convince myself that I wanted to study on a glorious spring evening. So I opened a kombucha, took a swig, and procrastinated studying, because of course, by reading what was underneath the kombucha's cap. It was a quote from the Buddha. 3 things cannot be long hidden: the sun, the moon, and the truth. I about had a panic attack, right there at Whole Foods, on the patio. You see, first year of medical school had been a good year. I liked studying, I liked my classmates, I liked the chance to learn every day, but deep down, I always knew I didn't really want to be there. But first year was pretty fun, so I kept that truth locked away in my unconscious, until that kombucha and the Buddha's truth unleashed it. Did I quit right there? No, of course not. I wasn't ready. So, not 10 minutes later there on the patio, I came up with the most elaborate defense against the responsibility of what I knew to be true of my life that I've ever figured out: becoming a surfer. To psychically survive, I moved to Maui for the whole summer between first year of medical school and second year and learned how to surf. Whenever I matched into psychiatry residency, I matched at UC Irvine in Orange County, where I surfed my ass off. The whole time, I was convinced if I could just figure out a situation where I could surf all the time, I'd be happy. I've realized this sounds so ludicrous now. At the time, I thought I could do it. I thought I could go surf and just be happy, while doing something I didn't want to do. So after residency, I got this amazing outpatient gig in Santa Barbara. It was 20 hours a week, completely part-time. It was work that I'd done consistently throughout residency, standard outpatient clinic psychiatry work. I had so much time to surf on my hands. I couldn't have been more unhappy because I wasn't being who I was. But I was finally ready to go figure out who I was, and I quit. And you know what? I haven't surfed in 3 years. Haven't needed to. I share that long story to illustrate the lengths we're willing to go to not be who we are. I became a board certified shrink and halfway decent surfer, that might be generous, just to avoid becoming who I was. But there's also another way of seeing it, which is that is the process that I needed to finally be ready to choose what I knew to be true about myself. Maybe I would have never got here doing something that I love to do every day if it wouldn't have been for medicine, honestly. I think that's the truth. So, no matter where you're at in this medical journey, try not to beat yourself up. Just try to understand why these excuses have worked for you. If you're mystified, as I was, consider talking to somebody. Consider therapy. That was the single most important thing that helped me quit medicine. And now, 3 years after I quit, excuses behind me, I can say confidently, it was worth it. If you'd like to know more about how I did it and how I'm doing now, subscribe to my channel. You can also join my weekly newsletter community where I give practical advice to people trying to build a life they love. It's the first link in the description below. Thanks for watching.